became a necessity, at least to shield her children from a society where stigma around suicide is very prevalent. Ever since her husband died, Anne says society has been unforgiving.
You're not expected to mourn someone who has died by suicide. It has been very stressful. There are times I've wanted to shut myself down because you're not sure what questions you will answer that day. There are times you don't even want to walk out and see the world.
People like Anne face a lot of stigma and discrimination. In many African communities, suicide and mental health issues remain a taboo topic, and the real stigma is happening within families, the neighbors, the police, the religious places, and this is making it harder for families to take care of their loved ones who are mentally unwell and to recover if and when they lose them. Some 500 people committed suicide in Kenya between April and June 2021, according to official statistics. Human rights and mental health organizations want to raise awareness on this problem and are actively campaigning for all countries to decriminalize suicide by 2030.
For those who do go through the criminal justice system as a result of a suicide attempt, it worsens the psychological distress. There are no psychology or therapy systems within the prison to support this person. And then when they leave, they have a double stigma of a mental health condition or a suicidal person and a criminal or an ex-prisoner.
But experts say a lot of work also needs to be done within families, religious settings and communities. They warn that continued discrimination against affected families could lead to mental health issues like depression and subsequent stigma reinforcing in families.
Stigma creates a sense of despair, right, for the surviving family members. But when you feel stigmatized or rejected, you go through depression. So if there were genetic predisposition to mental health challenges, then the environment is also contributing to stress, then you may find that there is a continuous series of suicide happening within a family.
The World Health Organization says that about 1 in 4 people who seek healthcare in Kenya have a mental health condition. Yet, there's very little literacy about the issues, even among primary healthcare workers. In June, the government unveiled a 5-year action plan to boost mental health structures, as well as increase funding. Caregivers hope that this will be used as a step to normalize conversations around suicide in the country as well.
Mercy Juma reporting in Kenya. And just finally, an amateur diver exploring shallow waters off northern Israel has found a sword thought to have belonged to a Crusader knight 900 years ago. The 1-metre blade was discovered by Shlomi Katzin in shallow waters off Haifa. It's thought the sword, now heavily encrusted with marine organisms, has resurfaced after the shifting of sands. The Crusades, which began in 1095 and lasted for centuries, saw European Christians travel to the Middle East to seize control of Jerusalem and other parts of the Holy Land from Muslims. Researchers believe the sword may be linked to the nearby Crusaders' citadel at Atlit, a coastal town. There are plans for it to be put on public display. And that's World Watch for today. I'm Max Toll. Mani?
Kia ora, Max. Wow, interesting story.
Yeah, I studied the Crusades at university, and I'll be keen to have a look at this one.
I knew there was a backstory as to why you're so passionate about that story. Hey, thanks, Max. And that is Midday Report for today, Wednesday, October the 20th. COVID update, including an update on the reopening of Auckland's schools, is coming up. Thanks to everyone that came on the show. Thanks to all who listened. And from the Midday team, kia pai tō koutou rā, kia koutou ki Waikato, tai tokiro me Tamaki Makaurau. All of yous in the north part of the country, thank you so much for holding it down in level 3, thinking of you all. Nā te mihi, kia koutou katoa. But for now, have a beautiful day and see you tomorrow.
RNZ News at 1 o'clock. Kia ora, good afternoon. I'm Sarah Bradley. The COVID-19 Response Minister will be giving an update shortly at Parliament. We'll cross when Chris Hipkins starts the media briefing. In the meantime, here are the top stories. A person with COVID-19 is at large after escaping quarantine in Auckland last night. MIQ officials say 3 positive community cases fled the Holiday Inn Auckland Airport Hotel last night. One 26-year-old man and one 33-year-old man were quickly taken into custody by police. The third person was on the way to quarantine from hospital when they absconded. They were given 10 minutes at home to collect personal items, care for a pet and lock up, but their security escort reported them missing. The government will guarantee 300 spots a month in managed isolation for people in the health and disability sector from next month. Healthcare and disability workers are now having to compete for MIQ rooms with other travellers. The Health Minister, Andrew Little, says this is making it harder for health services to get in the people they need. The ministry will work with district health boards and primary health organisations to identify who needs to be prioritised for MIQ spots. A 63-year-old man has been charged in relation to a protest held in breach of Alert Level 3 restrictions at the weekend. The Destiny Church leader Brian Tamaki was one of the organisers of the Auckland Domain gathering. The police say the man has been taken into custody and is due to appear in court today. They have also laid charges against 3 other people in relation to organising and attending mass gatherings. The National Party wants to give businesses greater certainty on when they can and can't operate. The opposition's Back in Business plan includes widening the wage subsidy, rent support, tax cuts, and giving money to vaccinated people to spend with hospitality and tourism businesses. It would also take any area with at least a 70% full vaccination rate and no COVID in the community down to level 1 straight away. Research reveals New Zealanders and businesses are complacent about climate change. The survey by the Energy Efficiency and Conservation Authority shows more than a third of New Zealand businesses do not think climate change will affect their business. Only 1 in 5 feel any pressure from customers and suppliers to do more to reduce emissions. And the Ministry for Culture and Heritage says further delays to the Erebus Memorial are prolonging hurt for the victims' families. The memorial will honour the 257 people who died when an Air New Zealand plane crashed into Mount Erebus in Antarctica in 1979. Protesters yesterday disrupted the start of building at Dove Meyer Robinson Park in Parnell. Opponents argue a notable pohutukawa at the site will be harmed. The ministry insists the tree lies outside the construction zone. That's the news. To the weather now, and this is the short forecast from Met Service to midnight on Thursday. For Northland, Auckland and Coromandel, fine today, periods of rain tomorrow, possibly heavy in Northland. Waikato to Manawatu, including Bay of Plenty and the Central High Country. Isolated showers, mostly sunny today, but cloudy.
Kia ora koutou everyone. I'll hand straight to Dr Bloomfield for an update on the latest case numbers, and then I'll run through a few decisions around schooling, MIQ and vaccines. Sorry, didn't give you much time to prepare, did I?
Right. Kia ora koutou katoa. So today there are 60 new COVID cases in the community to report. 56 of those are in Auckland and 4 are in the Waikato. Our total number of cases in this outbreak is now 2,158, and pleasingly, 1,389 of those have recovered. It is a drop, obviously, from yesterday's 94, but we do expect the numbers to bounce around, and as we've said before, the overall trajectory is that they will keep rising. 22 of today's cases are yet to be linked to a current case, but interviews are well underway, and of yesterday's 94 cases, 34 still remain unlinked at this point, but again, interviews are proceeding with those cases from yesterday. Today there are 43 people in hospital, 5 are in ICU or high dependency units, and all are in Auckland except for 1 person who is in hospital in the Waikato. Testing yesterday was really good, 26,330 tests processed around the motu, and there were 11,692 swabs taken in Auckland. It's very important we maintain that community testing at a high rate in Auckland in particular. and testing continues to be available right across Auckland at pop-up centres and, of course, at GPs and urgent care clinics. Please check the Health Point website to find out exactly where. Of the 4 new cases today in Waikato, 2 of those are close household contacts who were already in a quarantine facility, and the other 2 are known to have likely links to existing cases. So the total number of cases in Waikato to date is 56. 10 of those have now recovered. Testing continues across the Waikato, and I'd ask anybody with any symptoms in the Waikato to please go and get tested, particularly anyone in the Te Awamutu area, and or if you know you may have been in contact with one of the people who is now a case, please go and get tested whether you have symptoms or not. Now, yesterday, Newlands Shadbolt Park was classified as a location of interest. It's now been reclassified as an exposure event and been taken down from the Ministry of Health website. Having looked further into the event, which was being managed by a PHU elsewhere in the country, it's now been assessed as being an exposure event with a small number of people who are contacts. They are all known and have all been contacted and are all isolating. No one else has been sought in relation to the event. Testing in Auckland, the team up there has moved away from using suburbs of interest because the infections are now quite widespread across Auckland. Testing is going to be focused on those areas where they are finding a higher test positivity rate, where the risk of unidentified cases is potentially higher. So in that vein, people with symptoms, even if they are mild symptoms and even if you have been vaccinated, in Newlyn and in the North Shore suburbs of Rosedale, Redvale and Bayswater, please do go and get tested as soon as possible, and of course isolate until you get your result. The testing will just help provide us with assurance there are not undetected cases there in that community, and if there is, that gets detected and dealt with as soon as possible. Today, testing is available in the community testing centres at Health Newlyn, the North Harbour Stadium and the Northcote Community Testing Centre, and from tomorrow there will be additional testing available in Wairoa Valley Road. From Thursday this week, healthcare workers in our managed isolation and quarantine facilities will be allowed to work in other healthcare facilities without the need for a 48-hour stand down and negative test requirement. This will allow greater flexibility of using that MIQ workforce and of others being able to supplement that workforce and reduce some of the pressure, the real pressure that is on that workforce. It's particularly important in Auckland and Waikato as they move to supporting community cases to isolate at home. There is a range of public health and other measures in place that will provide a high level of security and low risk from these moves. That of course includes that all those workers have been fully vaccinated. There is frequent surveillance testing and robust infection prevention control measures in place, including use of PPE. I should say that there have only been 3 MIQ workers infected since the pandemic began, and all 3 of those were in 2020. Just a quick clarification around the 3rd dose for immunocompromised people, and again just reiterating this is a 3rd dose in the primary course for people who are immunocompromised. This is a 3rd dose of the Pfizer vaccine for those 12 and over for a small group of people. There is further detail going up on the Ministry's website this afternoon about what the inclusion criteria are and about how those people will be both identified and then receive their third vaccination. And that will not be through using the Book My Vaccine approach. So you will not be able to book a 3rd vaccine on the Book My Vaccine website. And the detail about who is included and how that process will roll out will be on the Ministry website later this afternoon. Finally, a shout out to all New Zealand's COVID-19 modellers. My colleague, Dr. Ian Town, our Chief Science Advisor, has described modelling work as crucial in helping both my public health colleagues, the public, and of course our decision makers understand the impact of different policies and decisions, including the impact of vaccination on our pandemic response. Scenario modelling in particular is incredibly useful in understanding the links between case numbers, hospitalisations and the impact of public health measures and vaccination. Our advice that we put through to Cabinet around alert level changes is informed by that modelling, and I just want to acknowledge how critical that modelling has been and how fortunate we feel to have a group of such capable modellers here in Aotearoa. Back to you, Minister.
Thank you, Dr. Bloomfield. COVID-19 significantly disrupted many of our lives, and I'm acutely aware of the impact restrictions have had on our learners in our education system. Exams are racing up for our senior secondary school students in particular, and the stresses and strains that learning from home creates become more evident by the day. The decision on schools and early learning services in alert level 3 areas is a really finely balanced one. We want to get our young people back into the classroom as soon as we can, but we also want to keep them and the wider community safe. We've been consulting with education and sector leaders, and based on the latest public health advice, have determined that students in years 11, 12 and 13 will be able to return to the classroom in an alert level 3 area from Tuesday the 26th of October, i.e. after Labour weekend. That'll allow those students back to school so that they can prepare for their end of year exams and complete their NCEA assessments. Learners in the age group are able to be vaccinated in that age group and will require them to wear masks whilst they're at school. Staff and volunteers working on site will need to have a negative COVID-19 test before returning. Children, young people and staff at higher risk of severe illness from COVID-19 should stay home unless they are fully vaccinated. Records will be required to be kept for contact tracing purposes. Face coverings on school transport will be mandatory, and staff and volunteers at schools in all regions will need to receive their first vaccination by no later than the 15th of November. I'm also confirming today that NCEA and scholarship exams will proceed, including in alert level 3 areas. With Auckland, Waikato and Northland experiencing further COVID-19 disruption during Term 4, the New Zealand Qualifications Authority has confirmed that these students will be eligible for an unexpected event grade that recognises the work they've done. While students will still be expected to attend exams where possible, the long-established unexpected event grade process will reflect what happens in any year where a student's attendance or performance in exams is affected by illness or injury. This grade is worked out based on their schoolwork throughout the year. So students in Auckland, Waikato and Northland who can't attend an exam because of a COVID-19 specific disruption will receive their unexpected event grade. Where they do attend the exam, they'll receive the better of their exam grade or their unexpected event grade. NZQA, we're working with schools to put public health measures in place to protect staff and students in the exam rooms. Those familiar with exams will know that social distancing is an integral part of the examination process and a normal part of exam conditions. While classroom teaching and learning was disrupted by COVID-19, students have continued to work hard and they deserve the opportunity to safely demonstrate what they've learned. So today's decision provides certainty to our senior secondary school students, while recognising that those who are not able to perform at their best will have their specific circumstances recognised. For years 1 to 10, the picture is a more difficult one. I'm not completely ruling out these students in Level 3 regions being able to return before the end of the school year, but if they do, we'll need to be satisfied that there are sufficient processes in place to be able to minimise any risk. We have to acknowledge that any settings where there are groups of children under the age of 12 create higher risk. These are people who are not able to be vaccinated at the moment. But there are some mitigations that can be put in place to help keep risks as low as possible. So we can consider things like rostered attendance to reduce numbers on site at any given time. In the warmer summer months, education outside the classroom in an outdoor environment where it is more difficult for COVID-19 to spread is also more possible. So Cabinet will consider the latest health advice and further decisions on schooling, particularly focused on years 1 to 10 and early childhood, next Tuesday. Coming to managed isolation and quarantine, the changing nature of our COVID-19 response as we enter a phase where we've got a more highly vaccinated community and when we're dealing with locally acquired cases in the community does prompt changes to our border settings. We're considering shortened MIQ stays and greater use of self-isolation for those coming into New Zealand, and I hope to be in a position to make more announcements on that in the coming days. In the meantime, we are making some changes to address specific challenges that some groups are facing. From the end of November, there will be an ongoing allocation of 300 rooms per month in our MIQ facilities set aside for critical health workers. We have created an allocation for ministerial travel, for trade negotiations and international relations. And decisions have been made about the November and December time-sensitive travel allocations. These are predominantly going to the health sector, agricultural sector, engineers and technicians, military and diplomatic personnel, and 284 rooms have been allocated to 350 people across those groups. That'll help us to see skilled workers from a range of sectors enter into the country to carry out work that will have significant benefits to New Zealand. I acknowledge that there's heavy demand for MIQ spaces at the moment, especially as we head towards Christmas. We do need to strike the balance between reconnecting with the world, bringing people home, looking after our local community cases, and of course looking ahead. To vaccinations, it wouldn't be the Wednesday stand-up without a quick update on vaccinations. I think we can all be very proud of what we achieved over the weekend. We need to keep that momentum going. Today we're launching a new campaign called 2 Shots for Summer. It predominantly targets the 16 to 29-year-old age cohort, the group that we have to get a better vaccination rate within if we get to get our rates really high, encouraging them to get fully vaccinated by December. We currently sit at 85% of the eligible population in New Zealand having had their first dose, 67% being fully vaccinated. The country also now has its highest altitude vaccine, a drive-through clinic in Arthur's Pass. I'm reliably informed that not only do you get to enjoy the good view, you potentially get a free coffee and a pie from the local retailers while you're there. And before I wrap up, I do want to have a shout out. It is World Cleaners Day. So a very big thank you to our cleaners. They are actually integral to our COVID-19 response as well. So thank you to them. Thank you for all the work that they have been doing over the last 18 months to help to keep us safe from COVID-19. Tova.
Minister, what provisions are in place for students whose families might be too anxious about them returning or if they're isolating as a close contact?
For those senior secondary school students, our indication here is that it is safe for them to go back. The concentrations of vaccination rates that we're seeing amongst our schooling population puts them in a similar position to a large workplace. Primary schools are different because they don't have that high concentration of vaccination amongst primary populations, but for secondary schools they do. So it isn't that much different to a large workplace in terms of the level of risk there. There are those additional measures in place. Schools will be working very hard to make sure they're keeping people safe.
What can you tell us about in the ministry press release today, perhaps is for you, Dr. Bloomfield, the low doses and the expired vaccines that were put into some people's arms? How was that able to happen?
Well, starting with the low dose one, this was similar to previous incidents where this has happened, where erroneously a vial that's just been used, and I should say that even once a vial has been used, there's still a residual amount of fluid in there, which is similar to the amount of that's in a vial before the diluent is put in. And so the incidents we've had similar to this in the past is where that vial that's just been used is picked up, further diluent is put in, and so people do receive a dose, but it's a very diluted dose. And shocking, and therefore what happens, and part of the process that's in place on every vaccination site around the country, is there's a reconciliation at the end of each session, and so it's picked up immediately, and in that case it was picked up and all those who were affected were followed up and given advice. The other incident, which was here in Wellington, was where the vaccine was within the 24 hours after it had passed that 30-day period. It had been in the 2 to 8 degrees special fridge, but it had just passed that 30-day period. Those people have been contacted and encouraged to get a further vaccine.
Are you worried about how that might erode trust in the vaccine rollout, errors like that?
I'm not, because these affect a small number of people in a program that's delivered over 6.3 million vaccinations, and the assurance I can provide people is that the fact that these were found is a reflection of the quality assurance processes that are in place to make sure if there are anything that could go wrong in the context of tens of thousands of vaccinations being delivered each day right around the motu, that actually our systems are there to find them and follow up immediately.
And Minister, with more positive cases self-isolating at home, how concerned are you about COVID spreading with people not following the rules, and what procedures are in place to stop that from happening? And perhaps you could also talk us through what happened with those 3 abscondees from MIQ, how they were able to escape.
So my understanding is that two of them, I'll work backwards if you like. My understanding is that two of the absconders scaled the fences. They were spotted doing that. They were out less than 5 minutes. They were being watched the entire time they were out, so the system worked as it should there. My understanding is that with the third unrelated case, this was a person who was given permission to return home to collect some belongings to care for a pet. They were escorted during that time. They were allowed to enter their home. After 10 minutes, they did not return, and they have been unable to be located since then. So that's all the information I have on that. So it was an escorted visit, but it was clearly someone who has provided wrong information and has therefore broken the rules. In terms of I'm just trying to remember the first part of your question.
Positive cases isolating at home, how concerned are you about COVID spreading with people not following the rules and what procedures are in place?
So we will still be applying a risk-based approach to the management of COVID-19 cases in the community. So those higher risk cases, particularly where we're not confident that they'll be following the rules, we still have the ability to move them into MIQ. Other cases where it's low risk, where people are following the rules and they can safely isolate at home, that is actually the better place for them to be isolating. Bearing in mind some of these people will be asymptomatic cases, so home isolation will become more of our response. Jane?
Given the criteria you outlined yesterday, Dr. Bloomfield, about home isolation, the case on Waiheke Island appears to have travelled while awaiting their test, moved to a place that isn't their primary residence, and we've also been told they've been involved in previous border breaches. What can you say about this case, and is that accurate?
I can give you some information not related to accusations around border breaches. I mean, those may be out there, but there's nothing to suggest that. The person's been interviewed by our public health team. They're an essential worker who was exposed, and they are isolating safely. They are able to isolate alone in a place that is where there's no contact with other people on the property. They've been assessed as low risk. The way they travelled to Waiheke Island was on the vehicle ferry, and they were inside the car the whole way. So, and there are no exposure events at all on Waiheke Island that's been assessed.
A scenario that you really, would want to see, people actually travelling, like choosing where they would prefer to self-isolate as opposed to, I would presume home isolation is in your own home with a lot of the things that you talked about yesterday. I mean, is that a desirable situation, people picking up sticks because they want to be on Waiheke as opposed to on Auckland?
Well, I can't comment on that particular case, but I do have confidence in our teams in Auckland in the nature of the discussion they have with people about their understanding of their ability to isolate safely. And for some people, that will entail going to another place so they can isolate safely away from their whānau members to protect their family members from becoming infected. And it sounds like in this case that it's all watertight and that the public health officials have assessed it as very safe there.
On the mainland, though,
with the third dose immunocompromised, we understand that it's not actually able to be proved or sought evidence that you are immunocompromised to get that third dose.
Yeah.
Again, is that accurate, and is that going to cause any problems?
What I would say, and the information will be on the ministry website presently actually, that the criteria are very explicit and quite narrow, and that people who fulfil the criteria will be reached out to from their clinician to come and get that third dose. It will be on prescription, and that it will be administered, but it's a very specific set of criteria. If people, once they've seen the list, are unsure, then they can contact their practitioner to see if they qualify.
We'll come to Joe and then Jason.
They'll have to have a prescription, when they turn up, I just want to get that clear, they'll have to have a prescription when they turn up the third dose. They can't just go up to a clinic, walk in and get it?
Correct. There will need to be, it will need to be on the advice of and on the prescription of their clinician, because this is a third primary dose in the course, which is different from everybody else who's having the 2-dose first course.
Can I just get some clarification, Minister, in the rationale around the year 9 and 10 group, because you're talking about the under 12s. There'd be very few in those two age groups that would be under 12. So if they're able to get vaccinated, why would you not bring them back into the schooling system?
One of the things it does do is recognise that we still want to minimise the number of students on site at this particular point as much as that we can. as we continue to get our vaccination rates up. And there will also be some logistical challenges for the schools as well. I actually had a conversation with a couple of school leaders this morning. One of the things they pointed out to me is that a number of their teachers have children under the age of 12 who won't be able to go back to school as well. So this will, I guess that wasn't one of the factors in making the decision, but it's certainly a flow-on benefit from it, that it will help the schools to be able to manage that balance as well. But ultimately, it's a numbers thing. We know that those senior secondary school students need to be back on site to prepare for exams, to do their assessments, and that's why we've prioritised them for coming back earlier than we might otherwise have.
And just in terms of the guidelines that you're going to be putting out for principals to do, presumably case-by-case assessments of teachers who may not be able to get vaccinated by that deadline, there will be some sort of quite niche type scenarios there, like pregnant teachers, for example, who are wary about the vaccine, are going to be going on maternity leave and then coming back vaccinated, but don't want to get vaccinated for a period. How are you going to get around those things, and when are you going to provide schools with guidelines around how to deal with it?
So what I can indicate is that the burden of compliance, if you like, between now and the end of the year sits with the individual rather than with the school. From next year, from when the fully vaccinated requirement kicks in, then there will be a compliance-based requirement on the employer, on the schools, to make sure that they're only having on-site fully vaccinated people. We'll be making all that clear in the order when the order is released. It is one of the things that we're working our way through to make sure that we're very clear about that. The Ministry of Education have also been working with the teacher unions and others around the processes that should be put in place here to deal with those who, for whatever reason, are not willing to be vaccinated. And there is an interaction with other provisions within their employment agreements. For example, teachers are able to apply for periods of unpaid leave, for example. So if someone decides that they're applying for unpaid leave for a year, for example, because they don't want to be vaccinated, we need to have some agreements around exactly how all that would play out. So those are the things that are being worked through at the moment. Of course, we couldn't do that particular piece of work until we told people what the requirements were going to be. So that's the work that's happening now.
And just one last question for you, Dr. Bloomfield. Health Minister Andrew Little has said that Taranaki and Tairawhiti DHBs have failed Māori on vaccination. Is he wrong?
Oh, well, there's no doubt that the rates are lower in Taranaki and Tairawhiti than the average amongst DHBs, and there are one or two others down at the low end of the range. What I can say is that I know both those DHBs have had very good discussions with our team and with ministers over the last week or two, and that they are actively working to get the highest possible rates and Māori coverage in their regions. I should also say that those DHBs, along with all our DHBs, have got high rates of coverage in our older Māori populations, which is good. They're the highest risk ones. The challenge that they are now working on, and some need to work a little harder than others, is to get the rates up amongst younger age groups.
With all due respect, the question was obviously wrong. Do you disagree with them?
I'm just giving you my view on what's happening there, and I'm telling you what is being done by the DHBs and how we're working to support
Jason.
The pair of Northland women that went into Northland and put the region into lockdown, have they been charged yet?
I don't have that information. Obviously, that's not a decision that I'm involved in.
What can you give us an update about what's happening to them? Are they still being interviewed? Where literally are they?
My understanding is that they're both in MIQ now, but I don't have any further information on that at this point.
Expect them to face charges or have any sort of repercussions for
That's ultimately not a decision that I make. That's ultimately a decision for others who have the appropriate authority to make decisions around charging.
Why is it taking so long to make a call on schools in Level 3? It's so late in the outbreak, it's late in the school year, and some kids already feel so far behind.
As I said, I think as I outlined in my in my introduction, that schools are the highest concentrations of unvaccinated people in the country once schools are back to operating as normal, and that it has been a huge factor. It has been weighing on our minds. The younger people, including those who can be vaccinated, they were the latest to join the vaccination campaign, and their rates of vaccination continue to be the lowest of the age cohorts being vaccinated. But they are starting to come up, and that's really encouraging. We want to see them come up further. So one of the things that we will be doing between now and the end of this week and into next week is making sure that where schools want to be delivering vaccinations on site, that the health providers are working with them to do that, because we know that we get quite a high uptake when that's available. So for some of those schools that are a bit nervous about this, one of my messages to them is get in touch with your local health providers and get vaccinations happening on site, because that will add extra protection to your whole school community when you do that.
So given the it's a concentration of unvaccinated people, why are you reluctant around on installing air filters into schools like you've done at MIQ facilities to help curb the spread? It's being done elsewhere. Over in Australia, we're seeing it happening.
The climate in many of those environments is different to ours. So there are warmer climates, and they may have air conditioning systems already installed in their schools. So they're adding extra filtration units to those air conditioning systems. The New Zealand schools typically are not built with air ventilation systems built into them. The built-in ventilation systems are the windows and the doors. And so installing air conditioning systems is a pretty big undertaking. And it would take quite some time and have a significant cost associated with it. As we head into summer, actually having windows and doors opened is often going to be the best way of ventilating those rooms anyway, and would be as effective, if not more effective, than an artificial ventilation unit sitting in the corner, for example.
Some of them just literally plug them in a wall, though?
Yeah, but again, a plug-in unit sitting in the corner isn't necessarily going to be ventilating a room as well as having all the windows and doors open. So there are assessments being done of classroom environments. There are some schools where the windows don't open, for example, and we have to look at what we do in those environments.
At all, or are you writing it off right now?
Oh no, we've looked at it. We've looked at the availability of the units. We've looked at the cost of the units. Hundreds of millions of dollars if we were to do that for every classroom. So clearly not feasible, and there wouldn't be enough. There's obviously a big series of international demand around these kind of units. But I certainly am saying it's possible where there's a justified need for it. So if there are classrooms with sealed windows they can't open and there's no other ventilation, then those are the sorts of things we would look at. The Ministry of Education do air quality assessments on classrooms outside of COVID-19 considerations. So the air quality issues are ones that schools have been, and the Ministry have been grappling with already.
So
I'll come over here.
Minister, Minister, what is the plan for the South Island?
At this point, we have to be aware that COVID-19 could still make its way into the South Island community, and by the time we detected that, it could have already started to spread. Which is why South Auckland and Wellington and the Hawke's Bay and and Taranaki, those other places where there aren't COVID-19 cases at the moment, are still at an alert level 2. I just remind everybody in the South Island that we are in this position we're in now because one person somewhere along the way contracted COVID-19. It was a week before we found out about it, and now we are where we are. So things can change quite quickly, and that is why we have these extra protective layers in place to slow any spread.
There's an argument that if this was the other way around, if there was cases in Christchurch and not in Auckland, you would not lock down Auckland. So why have you not made some kind of arrangement for the South Island where you effectively use the Cook Strait as a moat?
The Cook Strait is not a moat. There are still planes, dozens of planes every day flying between the islands. There are inter-island ferries flying, sailing between the islands. There is still a lot of movement between the islands.
And Dr. Bloomfield, there seems to be a concession that COVID spread to the South Island is imminent. How likely is that, and why is it likely?
Well, it's not imminent, and the way to ensure it's unlikely in terms of imminence is to keep the current tight boundaries we've got around Auckland and to retain the rest of the country in alert level 2. So if there is an incursion, it's able to be got on top of very quickly.
We'll come over the far side. I'll spread it around the room.
I was just going to ask Dr. Bloomfield about the testing request in Red Hill. Does that, in other North Shore suburbs, does that reflect some ongoing risk from the party over the weekend?
Not specifically. There's nothing, and we've checked with the public health team, there's nothing to suggest that there's been infection or any super spreading type event related to that party. It's certainly coincidental, and it reflects as much low testing rates there. So they've got a positivity rate that's crept above 1%, and we're wanting to get more testing done there.
Derek.
Well, I was just going to ask you, with the number of unlinked cases in Auckland and the fact that cases now are in nearly every suburb, there's been some talk about how contact tracing has changed. Can you just talk briefly about how contact tracing is different today than, say, it would have been in August?
Well, the first thing is, having learnt from our experience to date in the outbreak, we're not actively following up people who previously we would have classified as casual type contacts. because we've not seen any spread from casual interactions through the tens of thousands of people that initially in the outbreak we classified and followed up very rigorously. So that category's sort of been dropped. The other thing that's happening, of course, is we're moving to prioritising cases where we think there may be people who are at higher risk and they may be because they're essential workers and they're in workplaces, and really focusing on those higher risk cases. And we will be moving to an approach where that first interaction will be done in a very timely way, but through a phone call and a sort of a triaging phone call to assess the level of risk, the level of support someone might need, and then using our public health teams to follow up more intensively with those cases that are higher risk to find out those contacts.
Derek?
Just related to that, Carolyn Merkelnay said last week that the contact tracing system will come under strain at 170, 180 cases a day. Are you trying to bolster contact tracing capacity to have more breathing room in that regard, given that the modelling suggests we could be at 150 cases by the start of next month?
There are two things about that. Dr. McElnay was referring to if we kept the current approach, then the system with that quite intensive follow-up of every case and contact, that would put strain on the system. So there are two things. One is we're now having delegation out of Auckland. They're delegating quite a proportion, around 50% of the cases every day, to other public health units around the country to follow up, and our national team. But secondly is shifting the model, as I've said, to one where we're triaging the cases with an initial phone call, and then our public health units focus their efforts on the ones that are the higher risk.
What would your estimate be on the capacity under the new model then?
Oh, well, that could go to hundreds of cases a day, because the initial outbound call would be quite short and just eliciting really key information, and then we can use our public health teams who are on standby right around the country and have resourced up to maximum capacity. They would just follow up the cases that were highest risk.
The number of unlinked cases as well. I mean, it's often viewed as like an indication of the size of the iceberg underneath the water, right? So we're at 166 in the last fortnight now. So do you have an indication from modelers or from your own point of view on how many undetected cases might be out there that we don't really know about?
And would you mind please stop first, just towards the cameras?
Right, sure. Yes, so the question is about unlinked cases. What I would say about unlinked cases is, well, first of all, I would say that the modelling does still show that the R value is between 1.2 and 1.3. And therefore our case numbers are expected to grow and probably double around every 10 to 12 days. And will bob around a bit, as I said earlier on. The other thing here is that the number of unlinked cases we would expect to grow, and we're not. The important thing now is not to try and trace where the link is to the outbreak, but to focus on following up those cases and any contacts. So we're not quite so worried about where the cases have come from.
So if the contact tracing system does get overwhelmed, if it can't manage, what did you say, hundreds of cases, will you revert to asking positive cases to start monitoring their own family members, use the DIY system that they've used in New South Wales?
Well, in a sense, we do that already, because for many families, if someone's gone into a facility and other family members are staying at home, the most important thing we're asking them to do is, if any of them develop symptoms, to get in touch with health authorities very quickly. So yes, of course, the system will adapt and continue to evolve, just as the Minister's pointed out that we're continuing to evolve the quarantine system, and I've talked today about the nature of how we use staff across the quarantine system as well.
I'm just conscious of time, so you haven't had a question up the back?
Following Joe's question earlier about vaccine mandates for teachers, there's a critical papa in Hokianga where more than half of the teachers don't want to get vaccinated. The school feels that they haven't had any support from MOH for any vaccine information. It's on the brink of closure because of this. Is that concerning for you? Are you seeing that happen throughout New Zealand? And what should they do?
No, we haven't had widespread reports of that. If the schools are concerned about that, contact the Ministry of Education in the first instance, and we'll make sure that they're getting some additional support there.
I'm also on, I don't know if you saw earlier National released its economic plan for COVID-19 and included a opening up post December 1st, or when vaccination rates get to 85 to 90%. consent. What was your thoughts on some of those proposals?
Look, it's difficult to keep track. They continue to change. The proposals they put forward this week seem to be a bit different to the ones they were talking about a couple of weeks ago. So I haven't had a chance to see them, sorry.
Yes. The MIQ changes you've foreshadowed. In coming days, does that mean it's going to be part of Friday's big announcement, or is that next week?
Sorry,
Your changes to MIQ you talked about today?
most likely to be next week.
Okay. Under the SCEG reopening plan, the change to allow people to skip quarantine or spend lesser time in quarantine would be coming into effect in the early part of 2022. In recent days, the Prime Minister and Deputy Prime Minister have talked about Delta outbreaks speeding up that timeline. Is there any prospect of those changes coming into force in 2021?
Look, I think you will see some changes to our MIQ settings this year. And so I hope to be able to set them out probably either late this week or early next week, probably early next week. We're working through the details of that. So there will be some changes, but it'll be a progressive series of changes. One of the complicating factors that we have to work through is that at the moment our COVID-19 community cases are contained to Auckland, but MIQ operates right the way through the country, and of course people coming across the border want to be able to go right the way across the country and not just be in Auckland. And so that means the risk assessment is different in different parts of New Zealand at the moment, and that is one of the complexities that we've got to work our way through. So we will have more to say on that, and it will be soon, and I acknowledge that there are a lot of people very interested in the answers to those questions, so we're working very hard to get them the answers as quickly as we can.
Christmas is a date you'd like to give people some good news though?
Look, I don't want to raise or lower expectations either way on that one at this point.
So are you concerned that when senior students return, that classes may not be at full attendance, not just because of public health risk, but because students have had to drop out and work and prioritise providing income for their families, particularly in those low socioeconomic areas?
Yes, I am concerned about that, and one of the things I'm also acutely aware of is that the longer we leave it before we allow secondary school students to come back, the more students there will be in that category, and that has a significant flow-on effect for those students for the rest of their lives. So that is why we've prioritised senior secondary school students first above all else, because we want them to have the opportunity to do their exams, to get their assessments. It'll help to set them up for much greater success in the workforce or in whatever they're doing next, further studies and training and so on. So they are our number one priority because, yes, I'm absolutely attuned to all of the risks there.
And with those students, will they be able to qualify under that unexpected event grade, or if not, what support can be given to those particular students, whether it's by employers or the schools that they're a part of?
So those seeking an unexpected event grade still need to be at school. So those students should be sticking at school, they should be sticking with their studies, and I'd really encourage them to do that. I acknowledge that the going is pretty tough at the moment, but they have to think about their whole lives, not just the next couple of weeks. Jane.
Dr. McKee, actually full. You've said recently it was filling up and there were 488 in that other category. Is there any room left?
There is a bit of room left in the community quarantine for us to bring more cases into community quarantine. And of course people are leaving all of the time, so we still have the capacity to honour all of the bookings that have already been made. So those who have secured vouchers to come in, they'll still be able to come in. We have managed to free up a bit of additional space for further community cases to be higher risk community cases to isolate within MIQ. But it's a system that's it's pretty full. It's been pretty full for a while now, yeah. And so yes, that does put a bit of pressure on the system.
How many COVID cases are isolating at home? How many people with COVID are isolating at home?
Have you got that?
I don't have the number from today. I do know yesterday was 88 from 55 households, but we can get an updated number for you from today.
How soon could we see booster shots?
Okay, I'm going to do the last couple of questions. If you could be brief, and we'll try and give brief answers so we can get through them all.
Just on maintaining the momentum of vaccinations. Obviously, the Super Saturday, as you called it, was pretty significant, but it's significantly dropped since then. Have you just basically brought forward vaccinations that were already going to occur, and therefore you're not seeing that momentum anymore?
I think if you look at the first dose rate, the answer to that question is no. We did see a higher first dose rate on Super Saturday, and that was really encouraging. Many of those second doses, that will have been the case, so there will have been people who would have got them otherwise. But the first dose rate and the momentum behind that certainly helped us to get more first doses.
For the sake of brevity, I mean, we've not returned to the rate of doses as we had last week, for instance, right? We've dropped off since. Have you lost the momentum?
Oh, it starts to get harder and harder from here. There's no question about that. We still need about another 200,000 people across the country to come forward and be vaccinated who have not yet been vaccinated with any dosages to get up to that 90% marker across the country. So I think it might be just under 200,000 now, but it's hovering around that marker. And you know, it is going to be harder and harder. So there's no question about that. We're always going to reach this point at some stage. We're certainly there now. We know that we need to move closer to those people in order to encourage them to come forward to be vaccinated rather than wait for them to come to us. Tova.
How soon could we see booster shots offered to older Kiwis who may have had their vaccines more than 6 months ago?
We are all ready to go with booster shots. So we've got the booster shots available. We've got we've got the network available to deliver them. Just as soon as our technical experts, our health experts say, yep, this is where we think the science has landed on boosters, this is the time frame that we think the boosters should be available, should be made available to people. So we're ready to go just as soon as that process is completed. And I might get the Director General to update on that part of the process.
And just the first thing we're waiting for and expecting next week, the application from Pfizer for an adjustment to the current provisional approval to include a third or booster shot.
Take to approve?
We'll be doing it as quickly as possible, and we hope next week to lay out what the timeframes are.
But we are expecting to be starting booster shots, if assuming that's where the science all lands up this side of Christmas, so this year.
Apologies if this has already been asked. The party in Redvale, that's obviously one of the suburbs that you are looking at. Were there any cases that have spawned from that party or from that gathering in the Auckland domain on last week?
No evidence from either at this point.
The 300 extra rooms or the allocation in MIQ for healthcare workers, what's that going to mean for our COVID-19 response? Are you stoked to see that we'll have more boots on the ground eventually, both of you?
Well, we've been working really hard to bring in critical health workers since the borders closed. They've been prioritised for MIQ previously. This is just giving them more certainty to be able to plan and to allocate out those spaces across the people we know need to come in. But I think I can't remember the latest number, but it's a significant number of health workers who have already come in through our MIQ system.
It's thousands, but it's great to have those 300 places set aside, and we can work with the DHBs and PHOs then, yes, to make sure that we get our highest priority workers into MIQ.
All right, thanks very much, everybody.